would behave very differently. When you put something into a system, I mean, anyone who knows about skin would never just dab astringent toner on their skin and just say there, especially if you live in a dry climate, your skin would dry up like a prune. You have to use these things in a sequence. It was the synergy of each product working together. And I saw that with my skin. And that was how I developed the system. And my mother started using it. We started perfecting it. I figured out different things along the way, like the better toothbrushes to use and the fact that your sinus health is included in this whole biofilm of your mouth and your nose. I found out how to acquire xylitol and add that into the program. And all of this works together. That's the incredible thing. And when you use this whole program as a unit, well, my mother lived to be 95. She lived 50 more years with minimal dental treatment. I think she had a couple of cleanings along the way. I think she had a couple of fillings that fell out here and there that she had replaced. But I mean, her teeth, from having to have full dentures at 45 to living to 95 with the same number of teeth as she had at 45. Tell me about that one with minimal treatment. So, I started then suggesting this to my patients in my dental practice as I went along. I added to it because I worked in Switzerland and learned a lot about nutrition, timing of eating and drinking. These are all the things that I teach people about. Gum massage to get your gums to actually regrow. And the use of xylitol, I've perfected that along the way so that you have a kind of foolproof system. Now, you may not like one or other of these products. Listerine, isn't it? If you don't want to do it, you don't want to do it. But I'll tell you, nobody talks about the toxicity of fillings. I know they talk about silver toxicity, but what about the plastics in your mouth? What about blocking up the grooves where healthy bacteria is supposed to live with fillings in the first place? What about dental cleanings? They're stripping off the biofilm of your teeth. Do we want to do that? I don't think anyone's really looked at that scientifically. Do you take an antibiotic every 6 months to kill off all the bacteria in your gut to try and stay healthy? No, we know that's not the way. You every day try to nurture the good bacteria in your mouth so that you don't need an antibiotic. You're so resilient. It takes care of you. And that's my philosophy with your mouth. And you mentioned that I don't talk about flossing. I've never needed to. I didn't until I came to America and everybody's floss, floss, floss. And I'm like, really? What I had seen was that women in particular, who are so much more compliant than men generally, I think when they're told to do this stuff, they floss like crazy. And they have more gum recession and more sensitivity and more damage to their gums because they're given the wrong advice. It's kind of like me scrubbing my face. That wasn't the way. I created grooves and cuts and bleeding and treat it so that you get a healthy biofilm. There's no infection. And you won't have plaque. You won't have any plaque. There won't be any stuff stuck between your teeth if your gums are there. Now, if you're coming at this in a very late stage where you've got huge gaps because your gums have disappeared, you may have to floss to get some of that. Or if you've got a lot of fillings, because the fillings themselves create these places where food gets stuck. They got little ledges, or you got a crown that's the wrong shape. Or once you start having dental treatment, you're at much more risk of needing more dental treatment because you're at more risk of food getting stuck and things going wrong. Perfect teeth are worth hanging on to. That's why I teach people to reverse cavities so they don't need a filling. It's so valuable to have perfect teeth and hang on to them for your life. So that's the story. It's long, but it explains how I came about my system and why my system works.